You got to give Greg 5 seconds.
Oh, he said he was all set.
No. Okay, now I'm good.
Okay.
Sorry.
Hi. Okay, great. Welcome. We'll call the meeting to order. I just wanted to also remind everybody that this is both recording and a live stream of this meeting. So let's go ahead and get started with our agenda. We'll start with the privilege of the floor, and we have two individuals who have requested time for on the floor. So Tony, I'm going to have you go ahead and go first from Tosa Apartments. And so the way that this works is you have 3 minutes to address the board. So I'll go ahead and start timing when you start discussing. Okay, you've got the floor. Tony, you're on mute, so.
Okay. Hello, everyone. I'm assuming everyone can hear me.
Yes.
I have the floor in regarding 1289 Ellis Hollow Road, and it's trouble with the well. I'm not entirely sure what this meeting is for, but I can tell you that we've had Penyan, let me get his name, Barney Moravec Company come out, and they have since flushed the system, and it has been remarkably better. I do not understand why the tenants are contacting the health department before they contact us. The system, I don't know if you're aware of, is designed to identify leaks or overusage by shutting off halfway so that we can know that there's either a leak or an overusage. Then we go there. Once the tenant has called us, we go back to the system, release the float, look for leaks, and try to identify the problem while the system recovers. I think it's getting a little out of hand that the tenants immediately go to like the top shelf for complaints instead of dealing with it in-house. They're never without water any longer than it takes the maintenance man. Once we identify that there is no water, it takes them 20 to 30 minutes to get there. They're not without water any longer than that period of time. We've had to have water hauling come in once, and that was due to a major leak in the system. We repaired the leak and had the well we had filled up the tanks, and we've been throwing money and time at this well. I'm not absentee. We've trying everything we possibly can to make sure we don't have an issue. But I think these calls are turned into issues and not identified as part of the way the system is supposed or is designed to work. I don't have anything other than that. Am I supposed to ask for questions?
Yeah, let me go ahead and let the any of the board members ask if they've got any questions. Tony. So Tony, let me ask you a question. So we do have an enforcement action against you that we're going to be looking at today. Did you have any, which has nothing to do with phone calls? So did you have any comments on that you wanted us to be aware of? Related to chlorine residuals and boil water orders. So I'm assuming it's quality of the water supply. I don't know if Skip or Liz want to correct me on that.
That is completely, the water has never not been, the boiled water is due to when the tenants call and they say no water, immediately a boiled water is issued. The water, we test the water, we do all the tests and then bring them back. The water has never failed, ever, since I've ever owned that place. It's never had whatever you test for. This is why I say I think it's a little over the top, and I think that the calls are they're turned into a bigger situation than they really are. the problems we don't, I mean, I get it. If there's a leak, it's annoying. A toilet can shut down the system in 24 hours, or if a tenant doesn't like you, they can run the water. I get it. But as far as I can tell, messing with that system daily, having somebody check it daily, I honestly, and having somebody come out, we've had 2 well companies come out. We did some vinegar, chlorine system directly into the well, flushed it through the system. That seems to help. But you can't help a leak. That's not something I'm not going there and personally sabotaging myself because I enjoy these meetings. And I'm not taking a back seat and allowing all this to happen. A leak is a leak, and I can't help that. Just because somebody calls does not mean that they don't have water, or they're going without water for an extended period of time. Like I mentioned before, once the water is identified as being turned off, the system is designed to, we then go there and turn it back on, and that gives us half the system to identify what is the problem. Is it just a tenant over usage, or is there a leak? We send the maintenance man, goes to the entire building. He has a list of things that he checks. We replace cartridges in the faucets if there's a small leak. The toilet is the number one offender. We bring that toilet bowl cleaner because you can't see it. So we bring that toilet bowl cleaner to identify if there's a leak that you can't see because you can't hear it either. We take the necessary steps. I think that things are a little over the top and things are being exacerbated when they really don't really need to be. I've thrown a lot of time, a lot of money at this thing.
Okay.
And believe me, I wish there was municipal water there because that would solve all my problems.
Yeah. Okay, thanks. Thank you, Tony. Are there questions or comments from anybody else on the board? Well, we have him here. Shauna?
Hi, I actually was wondering, whenever someone is in violation, but is there any way that she can talk a little bit about how they go about doing this write-up? Because I don't think that they just come up with this out of nowhere. It would be nice for her to present it to us, and and we could do that, as we go through this, further in the meeting. But I guess I'm wondering where the connection is here, because I think he's referring to one thing and the violation is actually for something very different.
Okay. Other thoughts or comments on that?
Well, I mean, I understand the violations are due to the boiled water and the number of them, and the boiled water is automatically issued the second someone calls and says they have no water, when the system is designed to pause for someone to go there and identify. Because if we didn't have the float halfway through, it would just drain completely and no one would know until the water was absolutely positively gone. The system is designed to pause to identify an issue. So when a tenant calls, because the system has gotten to the point where it pauses, they then a boiled water is automatically issued. There's no like, hey, what was the problem? It's just come over, slap hot boiled water on the door. When you test the water, there's nothing negative. There's water there when they show up there. It's not full. The system has to recover, but it's, we have to identify a problem. The system is not designed to drain completely. I mean, if that were the case, then I could see the boiled water. Because that means then the well has been completely exhausted of all water, and now we have to wait. The tenants are not waiting any longer than however long it takes to get somebody there.
Mm-hmm. Sorry, I thought you were done. I apologize. It's hard to tell sometimes. Sorry.
I just
think have a question or comment? No. Okay. Any other questions or comments from board members right now? Okay, Tony, so we're going to move on and let other folks have privilege of the floor now, but you're welcome to stay with us if you'd like, and we will take this up again at the end of the meeting where we actually talk in more detail about the enforcement action that's against you, okay?
Okay.
Thank you so much for coming and giving us your time. Simon.
Yep.
Are you ready?
Yep. Sounds
Okay,
good.
you have the floor. Thank you for coming to speak with us.
Thank you for having me.
Yep.
I wanted to talk about testing. If Cornell proceeds with its reactivation plans, the ones they published yesterday, in particular, their intense testing of the Cornell community, the Tompkins County Health Department's reporting approach is going to drown under vast quantities of university tests. As surrounding residents watch college students return, we're going to need to have at least a sense of which results are students and which are in the surrounding communities. Reading Cornell's reactivation plan with its repeated concerns that surrounding communities will be more infectious than their highly tested students, faculty, and staff, it seems clear that the colleges will also need data about how much to fear us. As the reactivation report puts it on page 40, students should be aware that the prevalence of asymptomatic, mildly symptomatic, and pre-symptomatic positives is likely to be higher outside of the Cornell community, where asymptomatic testing will not be the norm, and thus they must be extra careful not to expose themselves to possible infection. Unless we know which test results came from Cornell or places with similar approaches and which didn't, we're going to have a very hard time telling what the incidence of infection really looks like. Massive numbers of negative results from Cornell's intensive testing will likely lull county residents, masking real issues here when they arise. This is already a danger today with intensively tested caregivers who are generally more careful than the rest of us because of the nature of their jobs. Please update your reporting practices to include at least on-campus, off-campus, but ideally include more information about cases. Steuben County's reporting is an excellent example of what will help us navigate these challenging times. Please explore it and follow their lead. Thank you.
Thanks, Simon. Any comments or questions from board members on this? Shauna?
Thanks, Simon. You make some really good points, and I've looked at the reopening plan and definitely agree with some of your thoughts here. I know that it was eye-opening for the legislature to see that the numbers of positives in the age range of 20 to 29 it accounts for about a third of our positive cases. So I do hope that whenever we have reopening in the fall, that there is a very clear message to the students to stay safe and social distance, and also make them very aware that, you know, they're living in a community that's much bigger than just Ithaca College or Cornell or TC3. You know, they're part of Tompkins County, and that's something that we pride ourselves, you know, in at least for a week having 0 positive cases. So I think there's, you know, we've been talking about accountability and a clear message. And it's been good also to hear, and Frank can probably pipe in later in our meeting, that all 3 of the higher ed institutions are working on a message that's concise, as well as that's shared, so that all of the students are receiving the exact same message. So thank you very much for coming and commenting for this public comment.
And Simon, I just want to make sure I have my notes correct. Your primary concern relates to how the numbers are being reported, correct? Or did I miss something else?
Yes, it's that the numbers are reported,
Okay.
but there are no details whatsoever on the dailies about where things come from. We hear about demographics occasionally, very late. I mentioned Steuben County specifically because I think they've found an approach where they share much more information without revealing identities of people. Tompkins seems unique in its reluctance to actually tell the story beyond the numbers.
Okay, and then from your perspective, having that additional information is useful to the community. Why? Why would having that level of detail be important?
Partly it gives us a much stronger sense of where the sources of infection might be.
Okay.
I know when the campuses were still open, there were all kinds of crazy rumors about Ithaca and Cornell causing all kinds of trouble, and it's not really clear how that resolved.
Okay.
In the case of Steuben County, there was a case where everybody thought that this like one fire company dinner had created all of these problems. But as they actually told the story, it was clear that there was one person who had gone there.
Mm-hmm.
I think actually having a sense of what's happening rather than just a rough, here's the infection temperature of the county is really useful.
Mm-hmm.
And I also am concerned just because Cornell is going to ramp up testing gigantically compared to what
Mhm.
we've been doing. So we need to have some way of telling what's in the gigantic pile and what's in the, oh, these are county residents who actually thought they were sick. Turned out they weren't. That's great.
Okay. Okay, other board members with questions? Okay. Simon, thank you so much. I think those
Thank you.
are comments.
Great. Have fun.
Thank you. Okay, folks, I will move on now to the rest of the agenda. Starting with our approval of our May 26 minutes. So I'll need a motion and a second. I have a motion from Janet to approve as written and a second from Sue. Any discussion on those? Changes? Okay, all in, you know what? I forgot, I got to use the raise hand function. Okay, so all in favor, let's use the yeah. Oh, we got to rate. Yep. All in favor. Let's do either a raise hand or a yes. So go to your participants and you should, or down along the bottom, you should get. I got a thumbs up from Melissa. I've got 1, 2, 3. I'm waiting for Sue and David. Okay, I got Sue. Okay. I think I'm not at majority yet, I don't think. All right, let me just double check just so I know we're doing it. Okay, I've got yeses. I've got Christina, Janet, Shauna, Sue, David, and Ed. Is Ed? Okay, so I think that's unanimous. Did I get everybody or did I miss somebody? I think that's everybody. Okay.
I think, oh, no,
Summary. What?
I'm sorry, I thought I lost Dr. Capel there, but he's there.
No, he raised his hand. Yeah, I think we're unanimous. Okay, so financial summary. So Brenda, I'll turn it over to you.
The financial summary was included in your packet. I don't have a lot more to report than what I wrote. We are in the midst of developing 2021 for submission to the county by July 1st. And if there's questions, I'd be happy to try and answer.
Okay, any questions?
I question, did the county give you any guidelines for next year with the understanding that the income of the county has been drastically reduced, or are they asking for something similar to this year?
So this year we were given a request to submit 2 budgets. One is a flat budget based on our current target, and a second budget is a 12% reduction. It is likely, I think, after conversations with Frank, that we will have to submit other iterations of the budget probably throughout the summer. Frank, do you want to add anything?
Yeah, so those are the 2 variables that the county has provided to us. It doesn't account for anything the state might do. And it doesn't account for any changes in the county's assessment of what we might need to do in the coming months. So this is going to be a very different budget season in that we'll be making multiple changes as we go through it. This is the first step to get something on paper. The county asked for the 2 different budgets. Much of it hinges on federal stimulus. And that has a trickle-down effect to not only us directly, but to what might happen from a state reduction perspective as well. So all of that's still kind of up in the air. And then, of course, sales tax is a big component of the county's operating budget. And obviously there's been, I think it was a 33% last month reduction over last year. So those are huge numbers that we're trying to deal with. But as we're creating the budgets, what will come to you is if there are any programmatic changes that have to occur due to budget cuts. That's likely the mechanism that we'll do this year. You'll see a budget when it gets closer to being ready to be publicized by the county. But as far as any decision making, your role is really around policy. So that would be if any of the budget cuts the department proposes would affect programming.
Thanks, Frank and Brenda. Any other questions from board members? Okay, great. Frank, do you want to keep the floor and move on to your report?
Yeah, if you just give me 1 second. Yes. Sorry, Greg Potter lost power at his house and fell off. So I've been doing the background stuff. Lauren just joined us, Lauren Cottrell. So he's going to be helping moving forward. So that's why I was a little distracted. My apologies. So report-wise, yeah, it's been an interesting month since the last time we've been together. The really good news is we haven't spent a lot of time on case investigations and contact tracing. We currently have 2 active cases here in the county, which is amazing. Nobody in the hospital. We are beginning to start to see travelers, international travelers. So we're getting those daily lists again. You may remember way back at the beginning, we were getting daily lists on people and needed to be put into precautionary quarantine. Those have started to trickle in again. And so there's work for Karen's team around quarantine, precautionary quarantine of those individuals. They're coming ones and twosies. It's not huge amounts of folks, but everyone is someone that Karen and her team has to work on. So from a disease perspective, things are going really, really well. And that's coupled with reopening. We're close to going into phase 4 with protests going on almost daily in the community. We've been really, really fortunate that folks are taking the guidance seriously, and thankfully the disease incidence is reflective of that. Much of the response activities have been centered around reopening. Obviously, as each phase reopens, there's new guidance from the state that creates a million questions, many of which Liz and her group are trying to answer for folks around their planning, what they can and can't do, and then any education and or enforcement that might be necessary related to reopening. Thankfully, it's gone fairly smoothly. EH has done an amazing job of keeping track of all the changes and guidance, communicating it out to the folks in our community, and then dealing with any issues that have come up. And there have been a handful, but I think for the most part, people are trying to be compliant. Besides reopening, probably the biggest issue we've been dealing with is higher ed and their approach to reopening. Information is starting to flow out from them. Cornell, I think yesterday, put out those plans that Mr. St. Laurent was referring to, at least the recommendations that have come up from their subgroups. Ithaca College has been making announcements about pieces of their planning as it happens. TC3 is a little bit different. They're part of the SUNY system, and they've been directed that their plan has to go to SUNY for approval before they're allowed to make any announcements about it. They're in a little bit of a different situation. The good news is all three higher ed groups are working together to a greater degree than I've seen in my 9 years here in Tompkins County. Obviously, they're doing their own work and figuring out their own details, but we have a weekly call with them all together so they can share ideas. There's been a lot of interest in uniformity, particularly in communication, which I'll talk a little bit more about in a minute. And also uniformity in some approach. I think we all recognize that it will be easier for us as a community if higher ed has similar approach, particularly to behaviors that are being requested of students, faculty, and staff as they return. So there's a lot of good work going on there. I have multiple meetings each week with the leadership from Cornell Health and the Hammond Health Center at IC. They are working together and trying to make sure that they're learning from each other and asking questions of me and Karen. So we are trying to help inform them so they can inform their campuses in their approach moving forward. So there's been no shortage of effort to try to have our higher education institutions be able to return in some form or fashion and do it in a manner that's safe for both their students, faculty, and staff, as well as the community. So I think there's a lot of strong work happening there, and I think ultimately our community is going to be better off for it. Circling back to the communication piece, Sam has been part of a communications group that Dominant Recchio, our communications manager for the county, and Katie Borgella, who's our planning director, got kind of brought in to shepherd that process. And they are talking about exactly what Shauna was referring to, clear communication to students, faculty, and staff, as they're returning about what the expectations will be, but more broader than that, to the community as a whole. Right? This isn't a us against them thing. Higher education is a cornerstone of Tompkins County, both economically, socially, in every way. And so we need them to get back, and we want them to do it safely, and we need the community to recognize that we're all in this together, and it's not just students that might be not following guidance. We're already seeing people, that live here year round that aren't following the guidance. So it's really about, we're all in this together, and we want to have clarity about expectations and clarity about what reopening is going to look like for the higher ed institution, so the community is as clear about that as possible. So, excuse me, there's a whole separate work group working on that public information component. The last thing, before I move to K through 12, Cuyahoga Health Systems, Dr. Evelyn and their team, they've been doing pilot work with Cornell around doing large scale sampling in a day. They had an event on Thursday that was, from all accounts, hugely successful. And so feeling really good that they're going to be able to support IC, Cornell, and TC3 in any testing efforts that they have related to returning. So all good news there. And again, we thank Cuyahoga Health Systems for providing that testing service here for us in the county. K through 12 is a little bit more up in the air. Since we last met, the governor did say extended school year for special education could be conducted in person this summer. I will tell you that TST BOCES, who provides those services for all of the districts except Ithaca City School District, has chosen not to do those services in person. So those will remain virtual for all the districts in the county, except for Ithaca. Ithaca is doing a hybrid model where there will be some face-to-face, but still virtual as well. Their main concern was being able to put in place all of the protections that would be necessary for bringing students back into the schools and in such a short time frame. So they've decided to stay virtual and focus on reopening for the fall for all students. There has been some direction from the state to the school districts about planning, but there is not yet direct guidance to them. And we also are not yet sure whether their plans are going to be required to be approved by the state before they are able to reopen. We don't yet know if that's the approach or if they're going to have the same affirmation approach as all of the other industries. Excuse me. So K through 12, they're working on it. Don't have a lot of fine detail just yet on how that's going to evolve. And the last thing I want to mention, you may have seen some newspaper articles in the last couple of days about limiting travel. The governor on Friday was his last daily press conference, so we're not hearing from him directly every day, which has been, well, we weren't hearing from him every day wasn't the highlight of our day. It was a place where we were getting a lot of information from. So we're relying on the control rooms now to get our questions answered. But he did make mention at a couple of his last press conferences, and I'm not sure, and this is purely my opinion, whether those were more political jabs at states that are now seeing increases in cases, particularly in the South, who at one point were saying, we're not going to let New Yorkers come to our states because you have too much COVID. It would be logistically extremely difficult to limit travel interstate, and quite frankly, it would have to be a state function of some sort. So I just wanted to put that out there. I don't think it's likely that that's going to happen, but there are rumblings, and the governor has certainly added to the voices on that issue. So I'll stop there, and I'm happy to answer any questions.
Okay, great. Thank you, Frank. Questions for Frank? Jonathan. You're on mute, Jonathan.
Frank, I've had a few questions I'm not sure I know the answer to, but could you explain what we're doing on travel quarantine? Who's quarantined from what country, et cetera, just what our rule is now? Because I think there's some confusion about that.
Yeah, so the state tells us who gets quarantined. We get a list every day. My understanding, that list is still generated by the level 3 and level 2 countries on the CDC website. But they don't, when they report it to us, they don't give us the country of origin that the person traveled from. They tell us one of the outbreak regions in the world without identifying what region that is. So I don't know, Karen, do you have anything additional on that?
No, I don't, Frank, you're right.
Does that answer, Jonathan, or?
That may be the only answer. I mean, I think some people are going, well, I want to go to France. If I come back, will I be quarantined? That kind of thing. Or I have relatives who want to come in. Will they be quarantined? And it's still somewhat unclear to me whether to answer yes or no.
Yeah, I would say if they go to the CDC website and look at the countries that are listed under level 3 or level 2, they should assume that they will be quarantined for 14 days upon return. And I know in level 3, most of Europe is included. And I think it's actually described that way as most of Europe, not individual countries.
Okay, thank you.
I looked on the CDC website because we have some residents coming, and essentially it's just about the rest of the world, except for maybe like New Zealand or 1 or 2 countries that are now at level 1.
Yeah, and the thing I don't really understand either is that for every other country, the US would be on their list, right? Because of the level of disease that we have, and there's no travel restrictions currently within the US. So I don't know how long that's going to last, Jonathan, or what the real or what the scope of that's going to be. It's been such a small piece of the work that we've been doing. We haven't really been focused on it other than to put the folks that are on the list that we receive into quarantine.
Thank you.
Okay, other questions for Frank? Janet.
Frank, I think I heard you say that Hugo Health System would be handling all testing of this? I'm talking about the college campuses. And then who would be doing follow-up from that?
Sure. So let me be clear. That's up to the higher ed institutions on who they choose to use for testing. We are highly encouraging that it be Cuyahoga Health Systems because of their connection to us and all of the good work that they've already done. And I do believe that's ultimately who they're going to select. But it is up to the university and colleges to decide. That being said, the way that it's worked with Cuyahoga Health Systems is they are notifying people of negative test results, and the health department is notifying and then doing case investigation and contact tracing for positives. So that is the general approach that will be taken. We are working with both Cornell and IC about contact tracing. Because most likely they're going to be calling at least their students every day that are in quarantine or isolation to check on them. And if they're already making that call, they might as well be making our contact tracing calls as well. And so we've asked them to, and they have already trained much of their staff in the Johns Hopkins training that the state made available, and we are prepping to give them access to the new ComCare system to be able to do the contact tracing in that in that system for us if we need them.
Thank you.
Anyone else for Frank?
Christina, I do have a non-COVID update I'd like to give if there's no COVID questions.
Go ahead.
Okay, great. So one thing that we've been talking about with both departments and as a county is the George Floyd situation and structural racism. And the county has taken a pretty strong position that we've got to do better. We've got to do better as an employer. We've got to do better as a provider of services. And quite frankly, we have to do better as a leader in our community. And so the county administrator has tasked the department heads and our departments to begin work around structural racism and what it means to us as individuals, to us as a department, and then to us as a member of the larger community. And so there's been a few town halls that Jason has held talking to staff about it. He gave a presentation with an outline on some steps that he's going to be taking from a county-wide perspective. Both departments, I've had all staff meetings with them on the last 2 Fridays, one for each department. And we've talked a little bit about, my commitment to us moving forward, and that, we have to be willing to have challenging conversations and really, question what we're doing, again, as an employer, but also as someone that's providing services in our community. We're going to be re-looking at the strategic planning process, which is likely to be kicking back up again in August, and figure out how we can make sure that addressing equity and structural racism can be integrated fully into that process as well. Sam is looking at the CHIP and seeing if there are ways for us to, again, incorporate more of this into community health improvement plans. So just wanted you to know there's a lot of work kind of happening on the very base level to get our arms around how we might move forward with this. But both the county and myself and the departments are committed to moving those issues forward. And I also want to share that, we've been talking about health equity. The Kresge grant was kind of centered around health equity. So we've been working on this for a while, but there's a recognition that even that work isn't enough. We have to do more. Our community, both here locally and across the country, have said that we have to do better, and we're committed to trying to do that.
Great, thanks, Frank. Any questions or comments on that? Okay, Sam, I'm gonna go ahead and give you the floor.
Okay, my power also went out, so I drove up to the health department during this few minutes. So now I'm back online. All right, so to just follow up on what Frank was just speaking about, I just want to reiterate that the CHIP, the Community Health Improvement Plan, has really been on hold to some extent due to COVID, but that we are really committed to revisiting it and rethinking it in different ways so that we can make sure that we're fully looking at the interventions that we already had listed and perhaps adjusting or creating new ones that that really use health equity and health and a racial equity lens to make sure that we're addressing structural racism as a public health issue. So we will continue working on that. We're identifying areas and policies that we want to work on moving forward so that we can get community engagement and input and make meaningful change in that regard. So, and I hope that moving forward also we can even more so draw on the expertise of this board to get feedback. I'm working closely with Dominic, who's our communications director for the county. He is really revamping our public information advisory board. So that we can use that board also as more of a sounding board for getting feedback about our messaging. And I think, you know, all departments will be able to take advantage of that, but I think the health department has a real role to play there. So, so we're working on that as COVID slows down. But I did want to give an update about our COVID communications. The team is still continuing to work daily in responding to public inquiries and social media. We've been working on, Dominic especially has been working closely with our news outlets to get articles written about the work that's happening and different issues that are coming up. We have posters that are available for download on our website, including this one that has different icons, but hopefully you've seen some of these posters around that are reminders to the public about wearing masks, social distancing, washing hands, and monitoring symptoms. And so those are out and about, but you know, please spread the word that they're available to download on our website too. And I'll stop there. Thanks.
Any questions or comments, Sam? So Sam, I have a question to the question that Simon, or the comments that Simon raised about how we're reporting numbers. Is that part of your conversation moving forward to think about, from a communication perspective, how we might report those numbers differently in a way that would make, you know, part of it I think is the Ithaca community, but my suspicion is also that parents and families who have students at Cornell or Ithaca College are probably also going to want information reported in a different way. And so it's not that you have an answer right now, but just that, is the health department considering that?
Yeah, and I mean, Frank and Karen can also jump in, but I think that throughout this process, we've been considering it, you know, how we're presenting data on a daily basis and trying to be as responsive and transparent about it as we can, and certainly open to suggestions and you know, other questions about how we can, ideas about how we can do it differently. And we've, you know, as you've all probably seen, I mean, we have adjusted and changed that daily table as we move forward. We've included that historical spreadsheet that goes back to mid-March, our first case. And so we really have iterated it, but yes, I'm certainly open to how that goes forward. And I think that this higher ed communication subcommittee that Frank mentioned also, that can definitely be a consideration for that group as well. As we move forward. And again, we've had lots of conversations and, you know, thanks to the health system, because they've really worked through a lot of the data with us too. So I'm sure we'll continue to have those conversations as well.
Great, thanks. Anyone else with comments or questions? Okay, I'm going to go ahead and move on to Dr. Claypack.
Well, good afternoon, everybody. I used to live in Steuben County, and I saw one of the Steuben County reports that had been published, and I was impressed that, you know, I think you probably could put a finger on an individual based on the kind of data they were reporting out. And that's not what we want to do. We don't want to identify individuals and violate their privacy. So I think moving in a direction to inform the community and inform the university community about testing on the campuses can be considered, but I don't know that we'd want to go to the level of Steuben County in that regard. On a different subject, travel, I've been concerned that domestic travel looks to be about as risky as international travel, especially not looking any better as the last week or two and more have gone by, and likely not to look even better as we go farther. So in terms of testing, we have New York State defined criteria that will allow us to, or allow an individual to show up at the sampling site and be tested. Those criteria I think you well know, but domestic travel isn't one of them. However, there is an other category. The other category says that if, in the opinion of the health department, an individual should be tested, that the department can make that happen. And so if we come across an individual whose travel was domestic and it looks pertinent that they should be tested, I would, in my capacity, choose to authorize that test. And it doesn't have to be me. It could be a member of Karen's team, for example, who would make that determination. But travel is an issue. Now, I have several ways that I have been communicating. So one is one of those little articles that appear on our website that I've worked with with Sam and with Frank and Karen and so on to craft about a variety of topics. So that's one way we've reached out and tried to inform people. Another is through practitioner bulletins that I've been putting out about each week for the last several weeks anyway. And in there I touch on, don't forget about travel, don't forget about this issue or that issue or the other issue. So we try to keep the focus on the important issues as we go forward. So I just wanted to mention that travel should be on our radars, especially domestic travel, as we go along here. With regard to the practitioner bulletins and the primary care surveillance network, in my submission to the board this week, there were various graphs on there reporting primary care surveillance data. So looking at the latest data this morning for, as you know, we have to submit our reports pretty far in advance of the board meeting. So there's a whole week plus that isn't in there. But the trend this past week has been even lower. So that's all consistent with what we're seeing in terms of case reports, hospitalization numbers. The difference is that there's a timeline here. So whereas the very earliest point that somebody can be recognized or that we can recognize the community as having an upstroke in potential COVID problems is either at the primary care level, what they're seeing daily, or as we're exploring with Liz Cameron and Skip and her department, wastewater monitoring for COVID. Those are the most real-time measures that we would have that would be capable of within a period of a few days, seeing if there's an uptick. And then as you go down the road, those people who get identified or who self-identify to get tested, those reports, once they get tested, are delayed as regarding the lab turnaround time, but those positive cases are another indicator, but they're a good few days down the road from when a person is, first identified as being potentially COVID. And then much later is hospitalizations. I mean, you're really talking a week, 2 weeks down the road before somebody usually is needing hospitalization. And then ICU, of course, often is beyond that, even by sometimes up to about a week or so. So while we're using those metrics, universities, the economy, our quickest measures can help to key us in, I think, to we see a red flag. And then by the time we see hospitalizations tick up and even in some ways cases, you're down the road a little bit farther. So I just wanted to make that point and make the point that indeed the surveillance reports are very encouraging, and I think we're now really seeing a definite trend convincingly downward.
Great, thank you so much. Any questions or comments for our medical director?
I have a question just to clarify the criteria for being tested. So the message I got from the governor's talks over the last couple of weeks is they were trying to encourage as many people to get tested as possible. And the implication was that there was no longer a need for reason. Is that not true?
Yes, that is not true. There are criteria for testing, the most recent of which was protesters being added to that. And one of the challenges around opening testing to anyone that wants it is who's paying for all of this. The Cuyahoga Health Systems has taken on a huge burden of getting testing available. And quite frankly, the insurance companies are pushing back that medical necessity is not a government order. And so there is concern about who is ultimately going to be paying for all of this testing that Cuyahoga Health Systems is putting out, essentially fronting the cost of here with lack of certainty. And there's even more concern if we were to test people outside of the state's criteria, that would not be reimbursed either. So that's why we have not expanded beyond the state criteria to this point. And I can't understate this. And Dr. Stallone and Dr. Evelyn have been working with Jason and our elected leaders to try to get some answers to this. This is a significant concern that there's not clarity on who is going to pay for all of this testing that is being done. For the state, who set up their own sites, they've taken on that burden, and I guess they'll deal with it. They have the taxpayers to fall back on. Cuyahoga Health Systems does not. And so they have done an amazing thing. And quite frankly, if not for them, I don't think our disease numbers would be where they are. They allowed us to identify people early and get them isolated to limit other exposures. And right now they're in the position of not knowing where or when or if they're going to get paid for all of this testing that they're currently doing.
Great, thank you. Any other questions or comments?
I would just add
Sorry.
that even though I said the trend is downward, I want to reiterate our basic message. And that doesn't mean that the coronavirus has gone away. And we all across the community need to continue doing masks, social distancing, and all the rest. I just want to make sure we don't lose sight of that.
Great, thank you. Ed.
Go piggyback on what Sue was talking about, because I was going to ask the same question, but it was really more in reference to your comment, Bill, about increasing testing for those who are traveling domestically, and I was kind of curious about whether or not the local health department is allowed to go beyond the guidelines of the New York State Department of Health to include those as testing guidelines. And I'm not sure if that question was answered with your response to Sue, ask question because Sue's was more open-ended, but I was just wondering if specifically if the health department decided they wanted to choose, say, domestic travel to certain hotspots, that could be something as a guideline as opposed to an individual case-by-case basis.
Well, there is that other category, and we have had a discussion within the department about using it, but it would be a case-by-case basis. If we were just to apply it willy-nilly, it could likely be argued that it was no determination at all. It was just opening it up, as Frank was saying, generally. And since it is an identified category in the New York State guidelines, if we document that somebody was approved by us to get tested, then there would be a leg to stand on, I would think, to at least argue the case that it should be reimbursed if reimbursement is an option at all.
And is testing reimbursed by insurance companies?
Well, here we got to where we're coming back to what Frank was addressing. So correct me if I'm wrong, but the statement is that an individual out of pocket does not need to pay money for COVID testing. That doesn't mean that insurance won't be billed for it, and that route of reimbursement is always sought for. But at the end of the day, if there are people who are uncovered, et cetera, hopefully federal or state monies would come to help defray costs.
So what we're seeing is if people are sick, so if they have symptoms, then the insurance companies are accepting they had a cough, they had a fever, whatever. But if people are getting COVID testing because they're an essential provider, because their business is just starting to open up, because they work in a nursing home and the state mandated that the nursing home employees be tested twice a week, those are not being covered necessarily. So I think that's the big issue for the country, for New York State and us, but also for the country, is we're mandating that all of these people get tested, but the positions of the insurance companies are, if there was a medical reason to, like I have a cough or I have a cold, then yes. But if it's just because I traveled to a hot spot or I have a certain profession and I'm exposed, not a real exposure, but I'm potentially exposed, then they're not going to cover it. So, I think this is going to end up legislatively being resolved one way or the other. And we're hoping that it's resolved in that somebody will cover it, as opposed to we provided a lot of testing for free.
Which would also clearly have implications for higher ed as well, correct? Because we would be doing surveillance testing and not symptom testing. So
I think our discussions with higher ed is that you're probably going to have to pay for this. If this is surveillance testing, we're going to be the lab. We're not going to be the person who's going after the funding for it.
Yeah, the universities are going to have to cover the funding for the testing. Right.
Great. Any other last comments or questions on this? All right, Karen, I'm anxious to see if you have anything left to talk about.
I think COVID's been well covered, huh? So I think the only additional facts I have to add is that our team, consisting of our community health nurses in both my division and also Deb's division, working together, we're ready and have been working 7 days a week in response to cases, and will continue to do so. So kudos to all of the staff. They've really done an amazing work. I don't have anything else to add to our packet, and we'll continue to support Dr. Klaypeck and his surveillance with local practitioners. We collect the data, and we've got great staff behind the scenes that convert the data into nice looking graphs that he's able to incorporate into his weekly bulletins back out to practitioners. So that's it from me.
Great, thanks, Karen. Any questions or comments for Karen?
Karen, you mentioned that you thought immunizations were going to be starting up soon, especially if the schools open in the fall. Is there anything super different about all that?
We're in preliminary planning stages to bring up our immunization clinics on a very limited, perhaps basis later in July, with our primary focus on children who have not completed the primary vaccination series. And then secondarily, kids who are still lacking needed vaccinations for school. We pretty much put adults on the back burner. So that's kind of our primary focus, but we're looking to hopefully get things back up in a very limited basis later in July.
And I thought I saw in the Cornell plan that they were going to require flu immunizations for all employees. Is anyone in the school districts or other places talking about that for the fall?
We're going to have some conversations about flu this fall. We've already had some initial conversations about starting earlier with education about getting your flu shot. The challenge is we're usually the last to get the flu shot at the health department. The large pharmacies get it first, then the doctor's offices, and then us. And so it's challenging to push it when we don't know when it's going to be available. But I think there's going to be a change in our language around flu this year to couple it with COVID, right? Because the symptoms are the same. And if you can get a flu vaccine to prevent you from getting the flu, then it's one less thing that could potentially have you in quarantine or isolation, while pending a COVID test result come back. So there will be some messaging around it. I don't know what the flu vaccine supply is going to look like, because all of the same companies that are rapidly trying to develop COVID-19 are the same ones that are building the flu vaccine too. So all of this still has to play itself out, but we would highly encourage people in a COVID world to get their flu vaccine, and that's our intention.
Great, thanks. Okay, any last comments for Karen? Okay, Deb.
Hi, everyone. I'll just give you a quick update on COVID work. Like Karen said, our nurses are doing actually much less COVID work and really just basically covering on the weekends and on call. My 2 support staff still helping also. We have some news for EI and preschool. The governor's executive order on June 5th gave permission for, as Frank said, for special ed classrooms to reopen. That included preschool. So I've been working closely with Racker Center and Ithaca City School District the last 2 weeks, just trying to answer questions, get more guidance. And we did receive more guidance from New York State Ed. They are both planning on reopening it, some small classrooms, only for those children that the parents really want to send them back. So Ithaca's looking at July 6th and Racker Center's looking at July 20th as a reopen date. And on the 18th, we received guidance from the Bureau of Early Intervention that we could restart face-to-face visits if our public health officials approve that. I met with Frank yesterday. Again, we're going to start very slowly. We have families that do not want face-to-face visits, and we have families whose kids have been waiting for service because they couldn't do teletherapy. So we are going to start with just those kids that have not been able to participate. And like I said, we're going to start slow. We don't want to open the floodgates. We also may see therapists that are not willing to go out into homes too. So we're going to try to work around all those issues and see how we can progress. I think that's it for me.
Great, thank you. Any questions for Deb? Okay, Jonathan?
Yeah, I have no further report.
Okay, great. Thanks, Jonathan. Liz?
I think that Skip and his team are starting to look a little tired or possibly suffering from brain overload. Other than that, I have nothing additional to report.
Okay, any questions for Liz on her report?
Liz, I was just wondering, I saw some signs for hydrilla along Cass Park. Is it bad this year or is that preventative?
I don't know that it's bad. I mean, this is their patches that they, I believe these were found last year and they're treating them, you know, this year. So it was known spots. There's also going to be starting one up at the Finger Lakes Marine Services Marina. So the hydrilla work is starting more, I think, routine. We did get it out in the lake. So, but that's not new news this year.
Jan?
Yeah, I just had a quick question about the COVID wastewater surveillance study. Is that a statewide study or just specific sites and we happen to be one of those sites, or how does that work?
They're hoping it can be a statewide study. And in fact, Frank signed a letter of support that Scott Freiberger drafted. He's the main EH person working on it, our public health engineer. Right now, it's a little loose from my understanding. I think they have funding. It started up with Onondaga and Cayuga, and then we got involved. Cornell is now involved now, and I think we're also picking up the samples for Cortland County. So they're trying to expand it, but they, I think funding is an issue, and they're trying to make it broader, but it is not at this point. I don't know if you have anything else to say, Dr. Klebeck. You might have read the emails in more detail than I did, but that's my understanding.
No, I don't. And, you know, it's, I think it's an interesting approach and hopefully will come to some fruition.
Yeah, we still need to work through like HIPAA concerns with release of the data, but we are collecting samples and submitting them right now.
Thanks.
Are food services inspections down because of the services being shifted to COVID, or is there happen to be not any evaluations that happened this past month for us to look at?
So New York State Department of Health, when COVID started or the state of emergency, they stopped doing field inspections and we followed suit, right? So we have not done inspections for those facilities because of COVID. We've been very busy responding to COVID. We are starting now to get out in the field more. But the food and restaurant inspections are still going to be, don't tell anyone, fairly limited, more looking for COVID compliance at this point. Of course, if we get a complaint or something, we are responding to those, but we're phasing in actual full-time, complete inspections at this point. And then we would be targeting them. We're doing other facilities, like we've done campgrounds and pools and things where it's easier to maintain the social distancing and other factors.
Jan.
Actually, I just had another quick comment. The activity summaries that were in the packet this month, those are new, I believe, and I found that quite helpful.
I'll have to reread it. I'm not quite sure which section you're.
Okay, never mind.
I know we included meetings and stuff like that. I'm not sure what other section. Is that what you mean? There was a.
I don't know. There was a couple pages of activities and how many hours were spent in each different.
Oh, yes. Okay. Yes. Sorry. Got it. Yes. That we've done a new format the last few months, and that's what we're planning to continue. So we're pulling data in a different way, and presenting it to you differently. So those we will be continuing.
Great.
Okay. Great. Any other questions? Okay, and then Frank, has the CSB been meeting or has anyone gone to that?
They have been meeting. I don't think anyone attended. Last month they heard presentation from staff about our single point of entry and housing and how that has been going during COVID, and also how the mobile crisis team has been implemented during COVID and the changes associated with it. So that's been their main focus. We did talk a little bit about the strategic planning, just that it will be picking back up in August. And remember that a couple of you are on what's the advisory group to the strategic plan with a couple of them and Shauna. So those meetings will be getting rescheduled. I think I have a meeting with the TEAS group tomorrow with Sam to kind of remap out getting that launched again. So stay tuned.
Great, thanks. Any questions on that? All righty, we're into new business. So we have one enforcement action with respect to Tosa Apartments. Liz, do you want to just give us the quick overview before we put a motion on this?
Sure, that's fine. So yes, this has been an ongoing issue with Tosa Apartments since, you know, we were notified that they had this bulk water added to their system, and they there was no chlorine present at the time, and so you know, we had to put them on a boil water order in order until they could certify that their system was safe, and they did not do that. So that's why you know, they have not submitted the samples. They've not hired an engineer to do the evaluation of their system. And then they have also not been submitting everything. They have submitted some things like their monthly operating reports, but they're missing some of the other information. So this is essentially a repeat of the order that was brought to you previously. Was it? I forget when it came to you. In January. Oh no, this isn't a repeat of the order, but they haven't done all of those actions. So it is before you.
Okay. So with that as an overview, before we start asking questions, can we get a motion and a second? Okay, David, are you making a motion as written? Okay, and Melissa, you're seconding that? All right, so discussion. So Liz, this is just to make sure I understand this. They have not paid from January, correct? And then there were additional issues. And so this is the payment for that they owed from a previous violation plus the additional
yes.
Things that have arisen since. Okay.
Yes.
Okay. And
Yeah, I was just wondering if there was communication issues, because it seemed like the person did not, the individual who was talking to us did not know about, or at least did not comment about the lack of chlorine residual and the requests for further you know, routine testing. Was there any issues with communication?
I think there are issues with communication. I don't think that is due to the health department because Mr. Bussey was apparently aware enough of the enforcement action to respond, to be connected to the Zoom meeting, but he still did not seem very familiar with the requirements of the order. The same thing has happened with when we sent the boil water order. So there has been a concern with trying to get a response, but the information has been provided to him.
Other questions from board members, comments? Okay, are we ready to vote? All in favor as written, either a raised hand or a yes, or so we have a yes from Christina, a yes from David, a yes from Sue, a yes from Ed. Am I missing anybody? Yes from Melissa. Okay, noes and abstentions.
Did you see Janet Morgan submitted a yes?
Did she submit a yes too? No,
I think that was through chat.
from her. I have no vote from Jan. Jan, are you not voting?
She did it through chat.
Oh, okay. I'm sorry. I'm looking at the thumbs up and thumbs down. I apologize. So it actually looks like it's unanimous with a yes. Okay. Okay. The last item, Frank, I'm assuming this is back to you, but I'm not sure, relates to the Board of Health vacancy, whether, I don't know if it's you or somebody else.
Yeah, and unfortunately, I don't have a lot to offer. I did reach out to the candidates that we had been talking to prior to COVID and have not been able to connect yet. So I don't yet have an answer on whether that person is interested in moving forward. If they are not, we would have to re-advertise and go through the process with the mayor again to find other candidates. So I'm gonna try to reach out again the next day or so, and we'll let you know.
Thanks, Frank. Any other questions or comments on that?
I'm just curious, can you guys hear me? Am I visible?
Yeah, we can see you.
Okay, because I was in a very bad area and I missed the large part of that entire conversation, and I'm sitting in a spot. What was just voted on?
So
regarding
so just 2 comments. So I'm going to answer the question, which is that the enforcement action as written was passed unanimously by the board. So I think it will be important that you take a look at that. Okay.
And this is regarding.
This
is regarding the boiled water.
Correct. But the other point I want to make is that it's not open. The meeting now isn't open for public comment. So I'm sure that Liz would be happy to talk to you, or Skip would be happy to talk to you after the meeting with more information. Okay.
Okay, but I'll have to do a phone call. I'm in a very bad reception area, but I appreciate the time, and thank you for being my podcast for an hour.
Yeah, you're very welcome. Thank you. Okay, so can I get a motion to adjourn from someone? From Melissa in a second. All right, from Jan. All right, everybody, have a great month. We'll see you next month.
Bye.